all the responsibilities, but the VA forgot to give VISNs some authority. Is the VA holding back mental health with bureaucratic BS?
Believers,
No, you stay here. I'm in charge.
do you feel in charge?
I've paid you a small fortune.
This gives you power over me?
What is this?
I just wanted to start with you. You spoke a little bit, Dr. Krobiak, about staff noncompliance and about the VISN mental health chiefs being kind of frustrated with their ability to understand what their role is. And could you expand on that just a little bit? Because I know we've talked about that in different parts of this committee and what that looks like.
Yeah, I think there's this poorly defined or lack of clarity in what these critical leaders' roles should be. In place of just being a consultative arm, we just repeatedly find that when we're in a facility, if there's an issue brought up and we go to the VISN to understand their knowledge or interventions, they either weren't aware or felt they couldn't intervene because that wasn't in their authority to do so.
So would it be helpful to clarify that authority?
We think so. We very much think so. And, the one report on the chief mental health officer is one example. And we've published other individual hotlines where we really tried to get that message across, that it was concerning that the facility was undergoing such trauma and the VISN either didn't know about it or didn't effectively intervene or monitor the events that were occurring.
So the monitoring is there, but just the enforcement of what to do once they identify a problem, what's next steps they can take?
Yeah, it becomes unacceptable for this regional source to just serve in a consultative role. To wait to hear about the issue has been ineffective, and we've repeatedly identified that in reports.
Thank you. Thank you very much for clarifying that. And then we've all heard the saying, if you've seen one VA, you've seen one VA. And my concern here is that all VA facilities should be operating off agency-wide standardized policies for mental health. How is it that interpretation and adherence to VA's mental health policies vary so much between VISNs and facilities? Either Dr. Weikers or any of you can answer.
Of why is there variation? There are several possible causes for that. One could be that our policy needs to be better clarified and written more clearly, and that's something that I take personally to heart and that I'm working with my team as we constantly review and update our policies to ensure that we have clear language. The other could be about ensuring that there's clear training to help educate the field staff and our colleagues at the VISN level about that. We work hard to ensure we have those trainings available and that they're consistent across the system. We work closely also with our VISN partners and our facility leaders with open communication. We have regular meetings with our VISN chief mental health officers every week. And then the VISNs, and I'll let Dr. Stazzoni say more about the communication that they have regularly between facility leadership and VISN leadership. But I think it's a matter of ensuring we have clear policies with standard trainings and clear lines of communication. And we're working on all of those things thanks to the OIG providing us some opportunities and areas where we may have gaps to focus on.
Could that role clarification include role clarification at the VISN level, what Dr. Krobiak was just talking about?
Yes, and I'm pleased to report that Office of Mental Health has already drafted a functional statement and roles and responsibilities with our partners in the VISN Chief Mental Health Officer role, and we look forward to having that role clarity for everybody across the system in each of the VISNs very soon.
Thank you. Dr. Stazzoni, do you have anything to add?
No, I appreciate Dr. Weeker's comments. And as you said, at the VISN level, our goal is to make sure we have the policies from Office of Mental Health and also suicide prevention. We meet regularly with them, as well as in the VISN we have regular huddles and also meetings regularly with the facility leadership to make sure those things are going forward. I think it's important that there is some standardization and understanding authorities across the network. As any healthcare network, you need to have standard processes and policies to follow through, and our goal is to make sure those are being followed through to the front lines. Healthcare is a very complex system, and trying to make sure we have the right processes in place to follow the policies to make sure our frontline staff can do the right things and follow through with those is critically important. And communication across the network, also up to central office and down all the way to the facilities is key. And I'll speak with VISN 9. We try to do that as much as possible with our chief mental health officer who reports directly to me.
If you're like me and never heard of VISN, then glad you made it. Seems the VA hired a bunch of snazzy people to do some research with the hope of making an impact on veterans' lives. This is probably why I have to answer questions about how much I drink and do I feel safe, and how my housing situation is every time I go into the VA. That's a lot of time and money being put into research, but it sounds like, as usual, bureaucratic bullshit at the VA is wasting a perfectly good idea. See if the new team is able to adjust windage and elevation to get us in the center ring.